Hi everyone, thanks for joining us here today on the Fluorescene show. Today I'll be discussing a case of normal tension glaucoma, which can be a little bit more difficult to manage compared to primary open-angle glaucoma. Before I get started, I do have a financial disclosure. I am a speaker for Aerie Pharmaceuticals. This is a case of a 38-year-old African-American female who was referred for a glaucoma evaluation by their primary eye care physician. This patient had denied any history of ocular trauma and denied any history of ocular surgery. She did report a family history of glaucoma with a grandparent having the disease. She reported that she was in good general health. Her only medical condition was a history of migraines and headaches. Patients entering visual acuities were 20/40 in each eye with her glasses prescription, which was -450 OU. Her IOPs were 12 in each eye, measured with Goldman tonometry. Gonioscopy revealed deep angles. Each quadrant was visible to ciliary body OU. Pachymetry revealed thin corneas in each eye at about 495 microns. The dilated fundus exam showed moderate cupping in each eye, as you can see on the OCT here. I graded the cupping at about 0.8 OU, and I noticed some superior and inferior thinning, as well as temporal peripapillary atrophy. The visual field here, as you can see, shows superior temporal wedges and inferior arcuate defects OU. At this point, I had diagnosed the patient with normal tension glaucoma, moderate in each eye. I had given her the options of selective laser trabeculoplasty versus topical therapy. The patient had elected for topical therapy. I initiated treatment with a prostaglandin analog, latanoprost, in each eye at night. The patient did very well with this medication. At her follow-up visits, her pressures lowered to 8 OU, which was the target pressure I had set for her in each eye, which was a 30% reduction. The patient's IOPs remained stable at the subsequent 4 to 5 visits, ranging between 8 and 9, and her disc evaluation and her visual fields were stable as well. Unfortunately, at the very recent visual field visit, her visual field in the left eye did reveal some progression. As you can see here, there was an increase in the superior arcuate defect, while the inferior arcuate defect remained the same. On the right eye, the superior and inferior arcuate defect were both stable with long-term fluctuation. At this visit, her IOPs were 10 in each eye, a little bit higher than the previous 4 to 5 visits. In normal tension glaucoma, even a 1 or 2 point increase in pressure can be significant. At this point, I had recommended intervention with SLT OU, starting with OS to better control her IOP fluctuation. The patient declined any sort of laser intervention. She was very afraid of having a laser done and had strongly requested to continue with topical therapy only. At this point, I had the option of adding a beta blocker in the morning, or adding a alpha agonist, BID, or switching to a fixed dose combination. I chose to switch her from latanoprost to rocklatan, which has latanoprost in it, and Ropressa. The patient did quite well with rocklatan. At her follow-up visit, her IOPs lowered to 5 and 7, 5 in the right eye and 7 in the left eye. Rocklatan can be a very useful tool in younger patients with busy schedules when you don't want to increase the number of drop bottles and when you don't want to increase the dosing. Rocklatan allowed for her to stay on 1 bottle only and QHS dosing only. Another benefit of rocklatan is that it can lower the IOP past episcleral venous pressure, which is typically between 10 and 8. The tarsidal component in rocklatan is able to get you past that floor effect, such as in this case here, when her IOPs were lowered to 5 and 7. So Rocklatan can be a very useful tool in patients such as this, where their pressure is already really low and they're still progressing, and they decline any laser or surgical intervention. I hope that this was helpful. Thank you for joining us today. I'm Dr. Judy Hu, and I look forward to seeing you on the next month's segment of Who's Got Glaucoma. Have a good one.